All right, hi Ansley, my name is Katie. I'll be your student physical therapist assistant today. Can you just go ahead and double check for me your first and last name as well as your date of birth?
Yeah, it's a big 5601.
Okay, awesome, perfect. All right, so on a scale of 1 to 10, I know this is your third visit with us and we've worked on some cervical traction for you. You have cervical spondylosis, so a lot of stiffness in your neck, just some arthritis over the years. I know that you've been having that pain going on, so we're hoping to be able to alleviate just a little bit of that. So with that in mind, what would you say your pain is on a scale of 1 to 10 whenever you do anything in your everyday living?
Like a 7.
Like a 7 out of 10. That's pretty significant. Is there anything you find you're limited to doing around the house or your daily living?
Can't look left and right when driving.
Okay.
Making it hard to leave the parking lot.
Okay.
And, can't really turn without shifting the whole body weight, so I limit from doing stuff that causes me to always move.
Reaching overhead.
Yeah, so there's not a lot of functional things I could do.
Okay, awesome. Well, our goal is to be able to get you there so that way you can get as pain-free as possible. Driving, reaching overhead, all the things. All right, so we're going to work on a sensation test before we even talk about traction for you again today. So if you can actually give me either one of your hands, you can keep your eyes open. This is what sharp feels like. This is what dull feels like. I'm gonna do this on your affected area back behind you. So you can go ahead and look ahead. Is it okay if I pull your shirt down just a little bit?
Yeah, that's fine.
All right. I want you to let me know if you're feeling sharp or you're feeling dull.
Sharp. Dull. Sharp. Dull. Dull. Sharp.
Perfect. All right, all of your sensations are there. Now, we're gonna do something called a vertebral artery test. So if you could lay down for me, flat on your back, facing the ceiling with your head over here towards me. All right, Ansley, I have the weight of your head in my hands. From here, we're gonna lower it down just about 30 degrees. We're gonna side bend, left ear to left shoulder, and then tilt. We're gonna hold this for about 10 seconds. And then we're gonna turn back to neutral. All right, do you feel any kind of nauseous, dizzy, like you might vomit? No? All right, let's do the same thing, other side. Ear to shoulder, slight tilt in that direction. And then return to neutral. All right, same thing. How you feeling?
Oh, good.
Nauseous, vomiting, dizzy, anything like that?
None.
All right, you can go ahead and scoot forward. I'll hold your head in the meantime to help you out. And back down. Okay, awesome. Stay right there. I'm gonna lower down this table. I'm gonna help you off, and then we're gonna get you over to the traction table. We'll ask you a couple of questions just to double check that traction is the right modality to pick for you today. And then we'll get started with the rest of our session.
Good.
All right. So we wanna be careful of your neck injury. So if you could actually roll over to your side, try not to twist anything. Perfect. And from here, I'm gonna help you sit up. So I want you to kick your legs forward. All right, how you feeling? Not dizzy, anything like that? All right, perfect. All right, you can go ahead and stand on up. We'll get you over to the traction table.
Okay.
One.
Hey Ansley, my name is Logan. I'm going to be another student PTA for you today. So, nothing much, man. I'm just here to help you understand everything that we're going to be doing today with your cervical traction. I know it's not your first time, but I just want to make sure that you know everything that we're doing with you today.
Appreciate you.
All right, of course. So today, I know you've got your cervical spondylosis, so we're going to be doing a joint distraction, and basically you're going to be putting your head in the machine again, and it's going to be pulling, yeah, that one right there. And it's going to be pulling gently and releasing the spinal processes and all the fun stuff in there,
Yeah,
in order to give you a little bit of relief.
Okay,
Yeah, hopefully we'll
sounds
be
good.
able to beat that. So for this, we're going to be using a 20-pound weight, because this is a joint distraction, so we want to be able to make sure that we're taking the weight of Ansley's head here and we're overcoming the pressure of everything that's going on there in order to provide relief. And we're going to be doing 3 steps. So if we come over here and look at this lovely screen. You as well, Anthony.
Oh.
So what we're going to be doing, 20 pounds at the top, Our minimum is going to be 10 pounds. We're going to be intermittent with these 3 steps because it's only 20 pounds. Our treatment's going to be 20 minutes long, and we're going to be doing 15 seconds on and 15 seconds off for our hold because of the joint distraction. And here we have our machine set up at a 30-degree angle so we can properly target his C5 to C7, which is where his affected portion is. So yeah, Simpson, come over here, and he's just going to make sure that you're cleared to participate in this still. He's going to read you off a list of boring questions. How does that sound?
Fun.
All right, awesome. You can go ahead and take a seat.
Thank you.
How you doing, MZ? My name is Emerson Philbin. How you doing today?
I'm good. How you doing?
Everything's good. So before you go on the machine, I'm listing some conjure indications or precautions. Conjures are pretty much anything that we're trying to avoid. You know, we don't want to put you on a machine and you have certain conjure indications that might affect your neck.
All right.
And I want to ask you a couple questions. So, do you have any acute injury that we're unaware of?
No.
Do you have any joint hypermobility?
No.
Do you have any uncontrollable hypotension?
None.
Is there anything that might hinder you from going on the machine?
No.
Do you have any dentures?
No.
Or TMJ issues?
Mm-mm.
Okay, so another list of precautions that we're going to also list is structural disease. But if the belt pressure is hazardous for the patient, displaced angular fragments, disc protrusion, if the pain is fully resolved, claustrophobia, unable to tolerate prone or supine position, or disorientation. So those are the contours and precautions.
All right, hey Ansley, now it is time for your treatment. So I know you've done this before, but I'm still gonna help walk you through it. We're gonna get you onto the table. I'll assist you in being able to lay back, all right?
Okay.
So you can swing your legs up onto the table. I'll help you in laying back. You can use your hands to help support you just to make sure that your neck gently goes into this little spot right here. All right, you feeling okay?
Mm-hmm.
All right, I'm gonna take our rope. It doesn't have any slack right now. There should be a little hole right here. I'm gonna place it right in there. As you can see, set at that 30-degree angle, we're targeting more C5, C7 right here. So it's set at the perfect angle for this. All right, now Ansley, I do have to be able to help adjust our little strap right across your head. It might involve me having to move your hair around. Are you okay with that?
Yeah, that's cool.
Okay, perfect. We also have a towel there, that way there's no rubbing on his head. That would be uncomfortable since he's gonna be here for a hot second. All right, we're gonna place this in right here. Ansley, does that feel okay?
It's fine.
All right, we're gonna take these straps, make them a little snug on either side. So there's one on that side. All right, Ansley, how's that feel? Is that too tight?
No, it feels
too
fine.
loose? Feels fine. Okay, perfect. All right, he's gonna relax right here. I'm gonna give him your kill switch. So Ansley, right over here, coming in on your left side. This is your kill switch. So if for any reason during your treatment you feel any kind of pain, I want you to go ahead and hit that. You're not gonna hurt the machine. It's just gonna pause it. Your safety is gonna come first with this. All right, now that he is ready to go, everything is preset on the computer. So what I'll just do is I'll push start. And then we're gonna stay here until we see this first hump about to be hit. I'm also gonna check in with him about a minute or so in, ask him how he's doing, if he's feeling any kind of pain, if he's any kind of 0 out of 10 sensation on a scale of 1 to 10, something is probably wrong. We need to be able to check in there. So I'll check in on his comfort, make sure there's no pain, make sure there's no absence of pain, and then we'll assess from there. All right, let's pretend like it's a minute or so through the treatment. Ansley, how are you doing? Do you feel any kind of sharp pain?
None.
What would you say your pain scale is on a scale of 1 to 10?
It's gotten better, so I'd like a 4.
Okay, a 4. All right, awesome. Well, my name is Katie. If you have any questions, you can yell out for Katie, say, hey, you, or talk to anyone that's walking around with a physical therapist shirt on. You also have your kill switch, so that way you can pause the machine anytime you need.
Okay.
You will be here for about, let's say 15 more minutes. So I'll go ahead and let you eat, and I'll come back and check on you.
Sounds good.
All right, Ansley, seems like your treatment is finally finished. How are you feeling?
Feeling good.
What would you say your pain scale is on a scale of 1 to 10? With 10 being, I need to go to a hospital right now, and 1 being, I feel significant relief. I feel perfect.
Significant, like a 2.
Like a 2. So you went from a 7 to a 2. That's awesome. It's a good sign that traction is working for you. All right, just making sure this is good to go before we do any kind of release. I can actually take this kill switch from you. Thank you so much. All right. So I'm gonna go ahead, lift this up. Relax this right here. All right. And then go ahead. Are you okay if I help get you out of this? Yeah. All right, and then I'm gonna help you up, okay?
Okay.
All right, I want you to go ahead and bend both of your knees, bringing them into your chest. Okay, perfect. I'm gonna help you sit up, and I want you to swing your legs around to the front. All right, ready? On the count of 3. 1, 2, 3. All right, I want you to stay here for a second. How are you feeling?
A little dizzy.
You're a little dizzy. All right, we're gonna stay here for just a couple minutes. Take deep breaths. You okay?
Mm-hmm.
Would you like a glass of water?
Yes, please.
Okay, awesome, perfect. All right, I'm gonna go ahead and help you come down. We'll get you that water. Do you have any questions before you come in for your next session?
None.
Awesome. All right, Ansley. We're gonna go over your plan of care as well, just to make sure you feel good on your home exercise program for any kind of stretching that you can do at home in the meantime, and then we'll see you for your next session.
Sounds good.
All right, awesome. All right, let's go and get you going.